to a peek behind the curtain, a chance to learn about some jobs that you may not know about. We are very glad that you're able to join us today. And I think if you're participating in this event this week, you probably have some level of interest in healthcare, and you've probably heard about jobs in the clinical space, such as nurses or doctors or others. But I wanted to start by introducing our speakers, who are Seattle Children's team members that are here to talk about jobs that you may not have heard about, but you might be interested in. And so we have 4 awesome team members here today. I'm just going to introduce them first, and then we'll have a chance for some conversation. Victor Garcia, you can wave, Victor, so people can see you, is an administrative assistant senior in our Cancer and Blood Disorders Clinic. Malia Dalio is a program management specialist in external affairs and guest services. Kiahi Higa is a business manager in our imaging services department. And Amy Ezzo is a program manager for volunteer workforce development and community engagement. So one thing I'll point out before we get started is that you may notice that all of these folks have something in their job titles related to administration or management. And these are roles that you might not see when you walk into one of our clinics, but there's a lot of exciting stuff going on behind the scenes, and these 4 are here to share more about that. So we have a few questions that we want to start with, but we really want to hear from you. So think about what questions you might want to ask these folks as you listen to their stories, and think about if there's a question that you want to put in the chat. You're welcome to do that as we go, or after they're finished with their initial introductions. We'll have a bunch of time that we've reserved for discussion. So if you want to take yourself off mute and ask a question, that's also fine, whatever feels most comfortable. So we will get started with a couple questions, and I'm going to go ahead and show the questions, but then I'm going to actually stop sharing my screen so that we can see each other better, because when there's a big PowerPoint presentation up, it makes it hard for us to see each other. So what I want to start with, and I think maybe we can start with you, Victor, if that's okay, and then we'll just go around, is just start with a basic, what is your job? What is your day like? Can you tell us a little bit about that?
Sure. Yeah, happy to. Welcome, everyone. It's really nice to see your virtual faces, by which I mean your names. I am an administrator for cancer and blood disorders, and I work with a group of neuro-oncologists. So these doctors primarily focus on children and babies with brain cancer. There are other things that they treat our patients for, but predominantly just brain cancer. And so I also work with some of the folks here as a chair for one of our inclusion networks for the hospital, which is called OLA for me. And it's a Latinx focused group. And we're essentially just, giving people the space that they need to feel, engaged and able to talk about just things happening in the hospital in our community, right? And then lastly, I am helping out human resources with some of the employee wellness kind of focused things that the hospital has in mind for the year. And my day, really, I spend a lot of it just facilitating stuff. I spend a lot of time in meetings, listening, and just helping just connect people, and really just figuring out how to solve problems that maybe aren't quite problems yet, but they're conversations that people are having about just things that either need to happen and or items that are coming up that we should all be aware of, right? And it really happens in every single one of those roles, whether it's official or supportive or unofficial. I tend to spend a lot of time with myself, by myself, and then I spend a lot of time really being available to my team of providers for any of their needs. So yeah, it's a really fun job. But yeah, I think that's all I have for right now.
Thanks, Victor. Malia, would you like to go next?
Sure. My name is Malia Delio, and I'm the Program Management Specialist for External Affairs and Guest Services. That is an odd title for a lot of different things. And so basically, External Affairs is everything that we are involved with outside of the hospital that is not research or foundation, related to research or foundation. So that's a pretty wide net. It includes government affairs. That's predominantly where I spend the most of my time and allocated support on. And it also involves community health and benefit. There's a medical legal partnership that we have under that umbrella, as well as child protection advocacy and outreach. And then there is suicide prevention as well that rolls up to that team. And then we have our guest services team and our patient transportation and community resource team under the guest services umbrella. So there is quite a lot of work done both at the hospital and outside of the hospital with all of those different respective arms. And I am working out of hospital administration. I was supporting our vice president of external affairs up until she retired this month. And so right now we are in a little bit of a transitionary period. We have not rehired for a new vice president in that position. And so my role has evolved this month alone. The CEO for our hospital has asked me to be, quote, the connective tissue for all of my VP's teams until we get a new vice president hired and possibly a Center for Public Policy and Community Health established at the organization. So my day-to-day work right now has shifted as of this month. I don't do as much administrative support as I used to do, similar to what Victor was explaining his day to involve. I do a lot more program-focused work. There is a grant, an endowment grant out of Alaska that I get to help oversee, and that's called the Cross Endowment Grant, and that was established by a gentleman who was a business owner in Alaska who left all of his money. He wanted it to be able to serve the children of Southeast Alaska specifically after his death. He used to quietly help families send their kids here to Seattle Children's to get medical care from Alaska because Seattle Children's Hospital doesn't just serve Washington State. We serve all of the WWAMI region, which is Washington, Alaska, Montana, and Idaho. And for all of those regions, we are the only pediatric specialty care facility that they have. So there is a lot of coordinated work with other clinics in other locations and states. So it's really fun to be a part of that specific grant because I get to review applications that come in, and I get to work with our chief operating officer to evaluate those in a committee, and then we get to decide who gets to get money. And a lot of times this money goes to really remote villages where they don't have access to not just medical care, but sometimes the grants are just asking for things like a refrigerator. So what I really like about that work is it helps to keep me really grounded in terms of we're really lucky in Washington and Seattle specifically to have a lot of resources available to us, but there are so many other kids and so many other families elsewhere that don't have those resources and don't have that access. So that's what I really like to be a part of the most. And then we also, with our government affairs, get to work with state legislators and congressional members in DC. So that's really exciting too, to be able to help inform lawmaking really and bills that get passed, and to be able to advocate for what we need to be able to deliver the care that we give families on a broader scope.
Awesome. Thank you, Malia. Keahi, how about, would you mind going next?
Not at all. And thanks everyone for choosing to listen to our breakout session, just hear our experiences. A day in the life of, or how my day normally goes, day in the life of a business manager in imaging services. Imaging services, also known as radiology. So if any of you have ever had x-rays, MRIs, CTs, interventional radiology, some of those procedures, that's the area that I work in, but just not on the clinical side. So my day usually starts at least once a week, rounding with our department. And what that means is just checking in with our clinical teams, literally walking in the area where all of our machines are and just checking in with somebody there about what they have going on. Is staffing okay? Are there any issues to know of? Any of the machines not working properly? After you get that information, there's usually a series of meetings set up. We like to call them huddles in the hospital. And these huddles, similar to the sports metaphor, you have all these people coming together for a quick check-in and exchange of information. So for radiology, I would be a part of this huddle and just share with the rest of the hospital. Machines are working okay. We have enough staffing for today. Or likewise, if it's not working, then I would report out just so that others know, we are having some issues to be aware of that for their patient care. After those huddles in the morning, it could be an array of meetings. As the business manager, some of my responsibilities include just making sure that our charges are being billed appropriately, that nobody's getting a bill they shouldn't get, and that if there is any issues on our side, that we can fix it. It's a complicated process, and we have so many people working on just the billing process alone. And really, it's not a venture, and it's not our prerogative to really send out these bills, but we do want to make sure we're doing it correctly. Another thing is just making sure that we have enough access, that those who need the care can get the care. And we work with our scheduling teams. And then even when you think about our radiologists, our doctors who read these x-rays and they read these different scans, we make sure that their schedules, that they're able to have time to read them and that they're at the right place at the right time. So it's a bunch of different meetings. And each day there can definitely be new things that come up that you just learn to handle. And I'm a member of our leadership team here, and I help support our nursing leader. I help support our informatics leader. And if you think about imaging and these big machines, all of these x-rays, these images, they're digitized. So we deal a lot with technology as well. And although that's not my area of expertise, what I appreciate is we're supportive of one another, that if people need help, we do the best we can to help. And this is, to Shauna's point, all behind the scenes, that when patients are coming for x-rays and MRIs, nobody really sees us behind what's going on, but we like to keep it that way so we can support our technologists, our nurses, and our doctors, that they're patient facing and that they're able to do what they do. So pretty much it's a mixed bag every day, some standard meetings, but overall supporting our clinical partners so that they can offer care to our patients and families.
Excellent. Thank you all for starting with that introduction. If you could now maybe just share a little bit about what your, a lot of the students who participated this week are really interested in figuring out what their own pathway is going to look like in terms of their career journey. If you guys could share a little bit about what did your pathway look like? How did you kind of get to where you are now? As to the students on the call, if you do have questions and you're worried you're going to forget them, please feel free to put them in the chat. And just a reminder to be thinking about that, because we will save some time for questions before we wrap up. But Victor, can you share a little bit about your what your career pathway has looked like?
Sure, happy to. Well, what I can say about it, it was kind of just like anyone else's here. It was a bit indirect for me, and it was years in the making. But I was coming from a military career and then a career in higher education, and really I was kind of just started to get focusing on being a decent administrator and an department manager. When I moved out here to Seattle, I kind of wanted to do something similar enough to what I had done before, managing a philosophy department, to really try to kind of push myself in a new direction. And so I had enough conversations with friends who were already in healthcare. And I just decided to see what Seattle Children's had to offer. So, it hasn't been settled, right? Going through a military career, that wasn't the plan coming out of high school. I didn't really have much of one, but I knew that I needed money to get to college. Once I had money to get to college, and I've been deployed a couple of times, I needed to study. And around the same time, I was studying and working full time, and I kind of rose up the administrative ranks at the University of Utah, where is kind of where I grew up. So, it's been a fun journey because basically I've been able to transfer a lot of the things that I've been learning every step along the way. And now I'm getting to support a really great group of talented folks who maybe had their path a lot more set for them early on in life, right? And what I'm doing right now doesn't take away, there's no comparison to someone else, right? It's been a fun journey. And so, yeah, it's been cool.
Thanks, Victor. Malia, how about you?
Like Victor, my path has not been very straight. I always knew that I actually wanted to be a veterinarian when I was growing up. And I wasn't particularly good at math. And so that was something I really had to work on. And I knew I wanted to go into some form of healthcare. I got into the University of Washington as a freshman, came here from Hawaii, where I grew up, where Kiahi and I actually went to the same high school. And I'm many years older than him, though. We came here to UW, and that was sort of just opened my mind to all of these other possibilities. I think there was never, my mother was a lawyer and my father was in business, so I knew I didn't want to do either of those because they were really stressed out. And I said, okay, I don't want a job that is so stressful that I can't enjoy my life. And I got into UW and I decided, well, I know I want to go into healthcare, but I don't know what my options are. And at the time, it seemed really like there was always this, it was nursing or medicine, right? And those were kind of the two lanes that everybody really seemed driven to travel in, or or engineering. And I didn't know who I was yet enough to really know that that was a direction that I wanted to commit to. And so I actually dropped out of college, and I took a little bit of time to work. And I told my family, I just need you to trust me. I need some time to feel this out. I don't feel comfortable picking a direction right now until I have a little bit of real life experience. And to their credit, they did, but they said, okay, you got to support yourself. So I started working at Seattle Children's, and this was one of my very first jobs, and right out of when I interrupted my college term. And I started working in registration in our emergency room, and I fell in love with Seattle Children's, and I fell in love with being around these kids who I thought, it's so funny because I have colleagues that work in healthcare in adult medicine, and they always say, isn't it so depressing? And I used to say it's the opposite, because I worked in adult medicine for 10 years after that in an emergency room in Honolulu as an ER tech. And I found that being around kids, no matter how sick they were, they didn't know to feel sorry for themselves. They didn't bring a lot of the baggage that adults bring with them into their care. And I found something about that so honest and refreshing. And it was never depressing. At times it was heartbreaking at times, for sure. You see child abuse, and you see kids getting injured and sick and cancer and the whole gamut. But there was never a time where it felt depressing. It made me want to work harder. It made me want to be here. It made me really feel like, okay, we're doing something really important that I can believe in. And so I sort of put the cart before the horse in that respect, where I knew this is where I wanted to be. It was just a matter of finding out which hat fit me best. And I ended up leaving and moving back home to Hawaii and working in an ER there. They paid for me to go back to school. I had a really great manager at the time who believed in me, and I had a lot of doctors I worked with who saw my potential, and they ended up paying for me to go back to school. So I did that, and I ended up working there for about 10 years, went to Boston, worked there in maternity for a couple of years, and then came back here to Children's. And I always used to talk about Children's when I was away, and I loved it so much. And I thought, okay, every healthcare system is going to be like this. This is just the way all hospitals are built, and everybody has resources and everybody treats patients like this, and it's not true. And I'm so glad that I had that experience to compare it to, because I don't take anything for granted now. And I see what we do have going for us, but I also see the importance of us being good stewards of those opportunities.
Thank you, Malia. Kiahi, how about you? Can you tell us a little bit about what your pathway's been like?
Yeah, some similarities from what Victor and Malia shared. Um, my original goal was actually to pursue medicine, and like so many young freshmen in college, gung ho to study the sciences. I realized as a I heard about the healthcare administration program. I studied at the University of Utah as well, Victor, when you mentioned it. And so when I heard about it, I went to an information session and they mentioned, in healthcare administration, you have the ability to influence the system rather than in medicine, you're influencing the one patient in front of you over and over again. So because of that aspect, that really drew me in. So I changed my course of study, and I went to grad school for this degree. When I was applying for my first job out of grad school, many healthcare systems across the country, they have a program called an administrative fellowship. Fellowship is just a broad term for a training program, like on the job training, and this one was just going to be in the administrative space. And Seattle Children's had one, a lot, like I said, a lot of healthcare systems across the country. And it's a program where you're an employee, but you're also in a learning phase. So if you think about the University of Washington, they have a school of medicine where a lot of their students can practice medicine at the hospital. It's very similar to what the program that I enrolled in, except again, it's not clinical. My kind of mentors, instead of being doctors, my mentors were our leaders at the hospital. So our CEO, other members of senior leadership. For one whole year, I was just following them around to different meetings, taking on different projects to really get a perspective of what it's like to see the organization from a very high, like 50,000 foot level, looking down and just seeing everything at play. And the administrative fellowship program here at Seattle Children's is a 2-year program. Year number 2, you actually get plugged into a specific team at the hospital. So instead of seeing that 50,000 foot level view of everything going on, you're now on the ground seeing what's directly happening in front of me. So over these 2 years, you should get a wide range of experiences of what it's like to sit when big decisions are made of strategy that's going to move the whole organization a certain direction. And then also sitting with the one employee who may need help or assistance with a project or a problem, and you're in that position to help. So whether it's that one singular issue or some big systemic issues, that's the administrative fellowship program in a nutshell. I was able to complete that program last summer. So coming out of the program, it kind of left me in a position of, if I want to continue at Seattle Children's, there needs to be a position for me. And luckily, that's how I got to the business manager in imaging services. This was an open position. I actually started during the pandemic, which was a little nerve-wracking because we did have a hiring freeze. My fellowship program was going to end. I didn't know if I could continue at Seattle Children's, but luckily, because of the importance of this role and the high need of patients seen in our radiology department, it made sense to have the business manager role filled. And I can tell you from kind of the day-to-day work that I explained in the earlier question, a lot to do. So my pathway came in through this administrative fellowship program. I did go to grad school. I went there, but there's a lot of different ways to get to these positions, and that was just mine. And I have other coworkers who took different paths as well. And so I'm just happy to share, like, that was my lane into healthcare administration. So many other lanes in, but if you're interested, I would highly encourage looking up administrative fellowship programs. There's some here in the state. MultiCare has one, Seattle Children has one, but again, it's all over the country, and it allows you to get on the job training to be a healthcare administrator.
Awesome. Thank you, Kiahi. Before we open it up for questions and a little conversation about next steps, could each of you maybe share one thing that you wish, as you think about your journey now in retrospect, looking backwards, Is there something that you wish you had known when you were 16 or when you were in high school that would have been super helpful, would have maybe, I don't know, saved you some time or saved you some self-doubt or made you feel more confident about something that you were maybe nervous about undertaking? Victor, can we start with you?
Sure, happy to. Uh, it's a really simple thing, and I really wish that somebody would have just said learn this early on, and I didn't. Nobody did. No, I had no guidance through any of this. But one of the things that I've learned later on in life was that like you have to learn your strengths, and I really mean it. Like, and it's as simple as taking an online personality test. I kid you not, because if you don't know your strengths, you don't know what to focus on. A lot of times we spend our time trying to figure out what our weaknesses are and building up our weaknesses, and you expend so much more energy trying to build up a thing that isn't necessarily natural to you. And there's nothing wrong with that. But if you don't know what your strengths are, then you don't know how to reinforce those. And one of the things that I'm now learning as an adult, only new to healthcare, this place has really kicked me around, my professional ego around, because they're so fast moving, right? That as I'm starting to focus on my strengths now, good things gravitate towards that. And so learn your strengths, focus on those, think about, reflect on how those strengths, what they bring to you naturally without much effort. And then I'm going to cheat. Everybody gave such substantive answers about on the last two questions. That iteration is key, and good things take a long time to build, you know? So yeah, that's the one thing that I wish I would have been able to say to 16-year-old me that had no direction at all and didn't know what he was going to do post high school, and was technically, statistically, was not supposed to graduate high school, right? So yeah, that's my answer.
That's great. Thank you, Victor. Malia, what comes to mind for you?
That was such a good answer, Victor. I'm gonna change mine now. No. I would honestly say that setbacks can be your superpower. Um, don't waste any of your time comparing yourself to anybody else. I think that, held me back for a long time. I felt, okay, I don't have this credential, I don't have this degree, I don't have this experience, I don't have this background, and therefore my opinion or my input or my contribution isn't as valuable as my colleagues. And all of the things, the job that I have now that I was hired for, to work for the vice president that I was hired to support in external affairs, you know, I didn't apply for that job. I literally had a former employee of hers heard that she was looking for to fill this role, and she thought of me. And I was working in our foundation at the time, and before that, I was working in clinical research and infectious disease. And then before that, I was in an ER. So I was kind of all over the map with my experience, but I felt like I hadn't focused on just one area enough to be an expert in anything. So I didn't really value myself in that way. But what I did do is I showed up every single day. Whatever I was doing, no matter what it was that I was doing, I gave it my all. And there is no job or no duty that was below me. You got to be able to do the grunt work too. It's not all about titles, and it's not all about, you got to be able to earn the respect of your colleagues by being willing to work hard and make sacrifices and get your hands dirty with them. That's what builds your respect, And a colleague noticed how I showed up, and she referred me, and they offered me the position the very first day I met them. So I didn't even apply for it. It found me, and it turned out to be my dream job. So I think, had I let what I thought at the time were setbacks in my life, leaving college initially, I went through a divorce, and that was the second time I went back to college. I went through a divorce. So there was a lot of things that I thought I had made as mistakes, or that the cards were stacked against me, and that didn't go right for me, ended up being blessings in disguise. And I think you just need to embrace that and really believe in yourself.
Thank you, Malia. Okay, Kiahi, what's on your mind?
Oh, tough to go last on this one. A lot of good things said. I think about where I was when I was 16. I think a junior in high school, right? And one of the things that comes to mind immediately is just, it's okay to have insecurities. It's okay to be nervous and to have fears and worries about where you're going to be. The decision I made to study or to pursue an undergraduate degree at a four-year university in Utah, and as Malia said earlier, I was, raised in Hawaii. I actually don't think that was probably the best choice for me, and I can honestly say it was my pride that stopped me from understanding kind of socioeconomically where my family was at that time. There was the way to get loans, and loans did help pay for some of my school, which I'm now paying back that. So again, I think it goes back to my pride and my ego kind of drove me there. When there were great opportunities in Hawaii, it would have kept me closer to family, like just understanding the sacrifices made. By me going that route, I actually lost time with family and friends during really important years of developing my own identity and seeing my family members and my older siblings as they were having their families, to be around nieces and nephews, my parents aging. So all of those things, I think just understanding there's many different ways to get there. And it was my pride that I went a four-year university on what we call the mainland. I went to grad school, did 2 master's degrees. I'm glad I have it because it qualifies me. But I think your terminal degree, whatever your last degree is, that one's going to matter. Because honestly, on your resume, nobody's going to ask you if you went to a community college. Nobody's going to ask you about any of those things. Nobody's going to ask you what your GPA is. So I think based on what you want in your life, your terminal degree, that one will matter. Coming out, if you and your family and your situation is after high school, I got to work for a little while, do it. And don't be ashamed of that. If it's community college, do it and don't be ashamed of that. And like Victor and Melinda said, it's never going to be a straight line. And as you gain life experience, as you gain and see others and meet others, then you start to realize, and that helps shape kind of what your future will be. But 16-year-old me, I would tell them the insecurities and fears you have and that pride that you have, kind of let that go and kind of sit back and be present on what's going on with your family, what's going on with your friends, and just what do you value. Right. And that's going to be different for all of us, and it's okay. And even if you choose wrong, just know you still have time to make it up. And your mistakes, like what was mentioned earlier, definitely can be made to be your superpower, as Malia said.
Thank you, Kiahi. I want to shift gears a little bit, because I think one of the things that you all shared at some point in your description of how you have sort of come to where you are now is a lot of trying things, right? Trying things on and seeing how they fit. Figuring out, in some cases, process of elimination, right? Like, I don't like that very much. This didn't really feel right to me. Or this really, like, I kind of came alive when I had this opportunity, this experience. And so I wanted to just pivot to Amy and have Amy share a little bit about the volunteer program at Seattle Children's, and to talk a little bit about the opportunities that can provide for someone to explore, to learn, to be exposed to things like what do we do here at Seattle Children's? What is healthcare like? What are the different jobs? And what is it that is interesting to me? And I think to the point so many of you shared, like, what am I good at? Like, where are those places where it just feels like it comes naturally to me? And so while we are still in a pandemic and there are a lot of things that are somewhat on hold right now, there are a lot of different ways to explore and to learn. And so if you heard something that you got excited about today, volunteering might be a way to start that. So Amy, could you talk a little bit about that and kind of where you see that opportunity and how you could see that maybe helping someone frame or queue up a pathway?
Absolutely. I first want to start by explaining a little bit about what I do, and then going back to some of the questions that the other folks answered, because it falls into this opportunity of volunteering. So my job as the program manager here is essentially to go around the organization and check in on people. How you doing? What do you need help with? So that's what I love. That's what our role is. as volunteer on my team, as folks who are volunteer managers. We're here to build those connections within the organization and to see what the needs are and to fill those needs with folks who have the skill sets or the interest in developing those skill sets. And that goes across the hospital. So I know that Victor, Malia, and Kiahi all spoke to kind of some of the different little subsets of the work that they do. We work across over 90 different volunteer departments and roles within the organization. So everywhere from the surgery center to child life to folks who, you know, there's opportunities, though not through our office, but there's opportunities for fundraising. On the administrative end, we have volunteers who support some of the tracking and the administration pieces of that. We have volunteers who serve in radiology, dialysis, folks who serve our families, so parents and guardians up in our family resource center, welcoming them to the hospital. When they check in with them. When they're admitted into the hospital, they check in with them in their room after the first day to see if there's anything that they need and help get them plugged into resources. So there's so many different opportunities. And that's what I love about the work that I do here. And that's what's really exciting about volunteering. And so my history is I started volunteering when I was in high school, in a hospital in my hometown, and that really exposed me to healthcare. And like so many other folks have already spoken to, and maybe some of you who are here listening to this presentation, I thought I want to go into pediatrics my entire life. Pediatrics is what I was going to do. I was going to be a general pediatrician, and I realized that what I loved about it was the hospital atmosphere. And I loved medicine, but I didn't necessarily have to be the person doing medicine. I really just wanted to be making those connections with the patients. And that's really one of the wonderful things that I get to do in my role, even on an administrative end, is making those connections with the patients and with the families. And as a volunteer, as a volunteer manager, I'm helping volunteers create those connections. So it's really just kind of, I'm able to have an even wider reach than I had ever anticipated. And so that's what's really exciting about volunteering, is you get to explore and see all these different things that you don't have to, go necessarily and take a class on it. You get to do that through volunteering. And so I really want to encourage folks, whether it's at Seattle Children's or out in your community, to really really explore the things that you're interested in, if you have capacity to, through volunteering. And so with regards to the opportunities we have here, we're actually expanding our volunteer program. And we're going to be taking a look at the opportunities that we can offer to the 16 and 17. Minimum age to volunteering here at Children's is 16. We're looking at how we can expand the opportunities that we offer 16 and 17-year-olds, and really explore, are there opportunities to get even more exposure to some of the roles that have typically been held for those who are ages 18 and older. But throughout Seattle Children's, there's opportunities both at our hospital, and then for those of you who might be in some of our other locations in the greater Seattle area, we have a North Clinic, a South Clinic, and a Bellevue Clinic. And we have opportunities at those clinics as well. Currently, North and South Clinic only have opportunities for folks ages 18 and over, but we do have just a handful of folks, opportunities for those who are 16 and 17 at Bellevue, and then we have opportunities here at our hospital. So I shared some of the opportunities that we have. One of the big things that our volunteers who are in high school, that 16 and 17-year-old age range, one of the big roles that they serve in is as messengers in our office. So what that means is whatever we're doing in our office, you also get exposure to. So everything from helping to make sure that the donations that we get for our patients are sorted. So you get to see all the cool toys that come in, to making sure that our patients have blankets that they need. Each patient gets a handmade blanket from a community member. So you're that connector between that donor and that patient in terms of that donation. Getting wagons and wheelchairs up to patients' rooms so they have something that they can get around on. There's a whole host of and then projects, project-based work, from creating packets for families who've just newly been admitted into the hospital with information about all those resources I was telling you about, and information about the unit that they're going to be on, and important phone numbers, that kind of stuff. So our volunteers assemble those, and we really create a really big team atmosphere when we're doing this as messengers, when we're doing this work here in our office. So it's a really great way to create connections with other people, other students, and adults. And it's also a really great way to connect that you're volunteering with. And then it's also a great way to create connections with folks who are serving in different roles in the hospital. I serve on a team of 6. So we have my leader, and then the rest of our team. We have 2 volunteer coordinators, an administrative assistant, and then an in-kind donation coordinator. So we're all in the office with you when you're doing your volunteering, and those are all folks that you would create those connections with as you come in through the volunteer process with us. And I know Shauna mentioned that right now our volunteer opportunities are on hold, but we do expect that we will be reinstating those. We're hoping for the fall to be able to bring on new volunteers, but I really encourage folks to continue to look. If you have access to our website, seattlechildrens.org, we're going to be updating that as we open up volunteer opportunities. And we've actually got a new system that's coming aboard that's going to make volunteering at Children's even more interactive, and that process to get on board volunteering with us even smoother. So if folks have heard, oh, it's really hard to get into volunteering at Children's, I want to dispel that myth. I want to dispel that myth. And if you have an interest, really encourage you all to check our website, but you now have my name, write it down. I really want to encourage you to take my name down, to call. You can call our main line. I can also give folks our phone number. You are welcome to call me if you have any questions about volunteering, if you have any questions about, or if you're having any struggles with, trying to get into the application or anything like that. You've already taken that first step by being here today, so I want to encourage you guys to please utilize me as a resource. That's what we're here for.
Awesome. Thank you, Amy. And I'm going to share my screen again because Amy just encouraged you, if you are interested in considering volunteering. And if you have any questions about that you think of later that you didn't get a chance to ask today, I just wanted to share that, remind you that, as Amy said, there is information that will continue to be updated on our website, which is seattlechildrens.org. And you are welcome to connect with Amy by email or phone. And then I wanted to just kind of change gears a little bit here. And I'm putting in the chat box now. Let me stop this for 1 second. We'll come back to it. But I'm putting in the chat box a couple of the things that I heard all of our presenters say they wish they had known and that they've learned over time. So let us know, students, if you have questions, things that you would like to know, that you think that these folks might be able to answer for you. Feel free to come off mute now. You can put your question in the chat. If you want to put your camera on, you're welcome to do that. That's not required if you don't feel like doing that. But let us know what questions you have that you'd like to hear the answers to from anyone here on the call.
Shauna, it looks like we have a question from Zara. Zara, thank you for messaging me privately. I have to message everyone back. Messaging privately is not an option for me. But it's a good question. I think everybody is interested in knowing. So how long is the volunteer program? Currently, though we are changing this, for anyone who is 16 and 17 years old, we ask for a minimum commitment of 60 hours, which is about 6 months. And like I said, we're going to be looking at opportunities because we want to make volunteering at Seattle Children's accessible, especially to folks who are underrepresented minorities in healthcare and here at our institution. That's really, really important to us. So Zara and anybody else, if you're saying, oh gosh, I don't know if I have 6 months, don't let this discourage you. Like I said, we're going to be making some changes when we do open up positions. We haven't decided exactly how long of a commitment that will be, but we'll be making those changes. I also want to encourage folks, if you are not familiar, we have a program called TIPS, Teens in Public Service, and we get 1 or 2 TIPS interns every summer. Teens in Public Service is its own nonprofit, but we get 1 or 2 TIPS interns every summer, and it's for about 6 to 8 weeks that they serve with us, and you're actually paid through TIPS. So that's another direction, another avenue that you can go through in order to get to volunteer at Seattle Children's. But it's also great because, like I said, you get paid.
Can I throw a quick shout out to and offer, we do have a Jim McDermott summer internship that I am managing this summer right now. And it is a paid internship and it's open to high school seniors through undergrad age students. So that is also an option. And that was on the slideshow that Shauna provided. So please feel free to apply to that. You don't have to have any prior experience at all.
Thanks, you guys. What other questions do folks have? Give folks a minute if anybody wants to put something in the chat, or again, you're welcome to take yourself off mute if it's easier to just ask your question out loud. And maybe, oh, here we go. Peyton says, can you list the names of these volunteer and internship programs in the chat for me as well, so I can make sure to check them out? Yes, and in fact, we can do both, and I'm going to share my screen again because there is some information on here that you can see visually. And we will also make sure that these slides get uploaded to the platform that you used to access the event this week, so that if you forget and you want to go back later, you can look. And these slides have links in them so that you can just click on them and they'll take you to the right place. Malia just shared that there are summer experiences. In some cases they're paid, some cases they're unpaid, that you might want to think about if you're interested in learning more. Again, sort of trying things on and seeing what fits. Malia mentioned she worked in the emergency department, she worked in research, she worked in foundation. So you might want to think about some of these summer experiences. And at Seattle Children's, we're just one location in this vast area. And a few examples of things we have here. If you want to learn more about what it's like to work in the clinical environment, we do run a summer nurse camp. Again, a lot of these things are on hold right now, but they're really great things to check out for the future if you think you might want to try some hands-on in-person activities. There's also a research training program for high school students that's a summer experience to learn more about jobs in research. And as Malia mentioned, there is a community health engagement and public policy internship, the Jim McDermott summer internship. And Malia is a great resource to find out more about that if that's something you'd like to learn about. So summer experiences, volunteering, just giving people, letting people know what you're interested in, because you never know, somebody you know might not know something about what your questions are, but they might know someone, right? So always sort of letting people know, boy, I really would love to know more about this, because you never know when someone is going to come across a person who would be a really great resource for you. The other thing to consider is, as if you are, if you're older, if you're a junior or senior, you're getting close to graduation. Malia mentioned that she went to work as a registration coordinator. That was one of her first jobs. And that was a way to get into the space and understand, to earn a living and to understand what was happening there. And so you might consider checking out, just going to the careers page at seattlechildrens.org or at another institution and looking for entry positions, seeing what do they require, what do they do? So things like family service coordinator or registration coordinator. And the other thing where you can learn a lot is also just researching training programs. So Kiahi mentioned that he's in imaging services and came to that by way of the administration route. But you might look into some local training programs, either certificate or associate degree level programs that train for some of these technical occupations like certified nursing assistant or medical assistant or one of the tech roles like in surgical, pharmacy, or radiology. And just by poking around on those websites for training programs, you might learn something that helps you think about something in a different way, or that might be exciting, or that might be like, whoa, that's not what I want to do. And again, process elimination is a big part of the journey. And finally, you might look into some longer term programs. Both Victor and Kiahi shared that they were in bachelor's level programs and trying to figure out what they wanted to do. And so you might look into longer term education or training programs that might be at the bachelor's level, or in some cases higher, for things like respiratory therapy, nursing, pediatric mental health specialists, which is typically someone who's done a bachelor's degree in psychology or in social services, or maybe in the research space, like a clinical research coordinator. So all of these resources are on these slides, which will be available to you later. And they're just a few examples. There's lots more. So that is just a little bit more information that you can take with you. But if there are any other questions that folks would like to ask, please do so. I don't know if there's anything else in the chat. I can't see that now that I'm sharing my screen. Maybe I'll stop sharing so we can take a peek. Any other students have questions they'd like us to answer, or things they're feeling curious about?
Yeah, so it looks like Stuart has asked a question as well. Again, Stuart, I can't respond to you privately. So the question is, would you recommend pharmacy technician on the job training at Walgreens or Walmart and then transferring to a hospital? Great question. We used to have volunteers who volunteered in our pharmacy. We unfortunately do not currently have the volunteers serving in our pharmacy, but I do know that any experience like being a pharmacy tech, which was required for actually having that certification was required to volunteer with us, all of that is great experience to get, really great experience to get. Now working in our pharmacy is different than working in a retail pharmacy, but yeah, absolutely. Just knowing that I worked with the pharmacy here at our hospital and just kind of what they were looking for, all of that is great experience.
Yeah, and I can add that we are always looking for pharmacy technicians here at Seattle Children's. It is definitely a role that we are hiring for regularly, and that there are a number of pharmacy technician programs in the area, and those typically take about 9 months to a year to complete. But we also hire pharmacy assistants here, and sometimes people may come into those roles if they're in pharmacy technician technology training programs. After the first quarter, sometimes students are encouraged to look for work as pharmacy assistants so that they can do exactly what Amy was just saying, which is to figure out what kind of environment you might want to work in, because a retail pharmacy operates very differently from an inpatient pharmacy in a hospital, for example, or even an outpatient pharmacy in a clinical setting. So there's lots of different things that you might like or not like about different settings. So I can definitely encourage you, if that's an interest. There are definitely jobs you would be very much in need in the industry, and there may be opportunities to kind of try it on for size before your training's even finished, depending on what your interests and skills are. There's another question that's come in from Peyton. Are any of the presenters willing to share their emails? So if we have questions later, we could reach out to them. And I think Amy and Malia's emails are both on that presentation, but Malia has just dropped hers into the chat. And then there was a question about the summer nurse camp. Can you tell me where and when? So the summer nurse camp typically runs in the summer, and it's usually kind of designed to align with the end of school for high school folks that will be going into their junior and senior year. So usually late June or early July, and it's usually about a 4-week experience. We are not running our summer nurse camp this summer, unfortunately, but usually the application comes out in January or February and is due sometime around March. So if that's something you think you might want to do next summer, the link that I shared on on our site will take you right there, or you can go to seattlechildrens.org and just put in the search box summer nurse camp. It'll take you to that page, and you can find a lot more details about what it involves when it is running. And I see a question from Zara. For the internship, will there be an interview? Zara, I'm not sure if you were thinking about the Jim McDermott internship perhaps with that question. Malia, maybe you can share a little bit about that one as an example.
Yeah, sure. So yes, there is an interview for the Jim McDermott internship, but because the age range that is open to, we do include high school, high school seniors or recent grads, and it's not an intimidating interview process. And in fact, if that's something that you or any of your friends are interested in, please feel free to email me directly, and I'd be happy to have a phone call with you just to kind of give you more details and then to coach and prep you for that a little bit. And, just let you know a little bit more about it. Happy to set you guys up for success in any way that we can.
Thank you, Malia. All right, I know we're starting to come up on the end of our time. I think we just have a few minutes left. Are there any final questions or any clarifications? Did we use any terms that we we shouldn't have used because they're abbreviations or technical words that we can explain?
Shauna, can I just do a real quick encouragement for anyone who might come on as a Seattle Children's staff member in the future? All of us, Victor, Kiahi, Malia, and myself, are all leaders of something called an inclusion network. Victor spoke to that a little bit earlier in terms of his work with the Ola Inclusion Network. Victor and I both are on that inclusion network. And so I just want to encourage folks. Kiahi and Malia just started the Pacifica Inclusion Network, and it's just a really great resource for folks. So if you do come on board with us as a staff member, we really want to encourage you. There's other networks as well. To find something that fits with you, it's a really great way to build community. And I think you'll find in an organization like this, in many hospitals and many organizations have inclusion networks, also known as employee resource groups. Those are just a really great way to create a smaller community when you're in such a large institution like Seattle Children's or any other healthcare institution. It's a really great place to create that community. And I know all of us have just really found friends among those who we are in those groups with. So really want to encourage folks. And those folks will help you on your journey as well. We continue to lift each other up within those little inclusion networks, and then our larger inclusion network group. So there's a lot of really great opportunities to, I think Malia talked a little bit about mentoring and getting, folks who help you along the way and creating those connections and doing outreach. And those inclusion networks, once you get into an organization like ours, are a great way to do that.
Thank you, Amy. Yeah, that's a great point, and a good reminder to think about for the future. Well, I really want to thank everyone for joining us. If there are any final questions, you're welcome to put those in the chat. If there are questions you think of later, all of the folks here have shared their emails in the chat, and just a reminder of everyone's names here as we get ready to wrap up. And mostly just really wanted to thank you for choosing to spend a little time with us this afternoon. I know it's been a long week, and you all probably spend a lot of time in front of computers. So thanks for taking some time to visit with us this afternoon.